Noswaith pawb. Good evening to you all. Thank you for the opportunity for letting me speak this evening. For those of you that don't know me, I'm Kirstie. I'm the Postgraduate Dental Dean in Health Education Improvement Wales, and I'm going to spend a few minutes just talking to you about the workforce and some of the challenges and opportunities that we are addressing and taking forward at the moment. I'm just going to spend a little moment telling you what HEIW does, because for many of you, we may be a little bit removed and you might not be aware of what we do. We're a strategic health authority that has responsibility for the workforce and the education and training for health and social care in Wales. We were established in October 2018, and three legacy organisations came together. That was Wales Deanery, the Workforce Education and Development Service, and the Pharmacy Deanery. And from that, HEIW has been established. There's a list of all the roles and responsibilities, and that's certainly not exhaustive, but it gives you a flavour. Just as some statistics, facts and figures of how many workforce we're looking at. We're talking about training, and you'll see in there highlighted is the dental workforce, the dentist and the DCPs, and we'll expose that a little bit in a little bit more detail in a minute. HEIW produced in lockdown in October 2020 an ambitious workforce strategy for health and social care in Wales, which covers all of the workforce and has 7 key themes that you will see there: the motivated and healthy workforce, attraction and recruitment, seamless workforce models, digitally ready, supply and shape, leadership and succession, and excellent education and learning. We're very much invested in all of those themes in dentistry, and we are early on in the workforce journey, but it is something that we are addressing and we're taking forward. And again, it will come out as we go through this. So what do we do in terms of dental in the workforce? We commission dental hygiene and therapy undergraduate training, and we've commissioned that through Cardiff University historically and going forward. And also Bangor University have been awarded a contract to train dental hygienists in North Wales for the first time. With dental foundation training, which many of you will be involved in, and we do that for dentists and for therapists. Dental core training, again, many of you will be familiar with, and dental specialty training. Well-established routes for dentist training. We train clinical education supervisors who are involved in those programmes. We have a dental professional support unit that provides help and support to dentists in difficulty and candidates wishing to come through the PLVE route. We do a lot of work in the workforce development space, upskilling and reskilling the workforce, and our continuing professional development and quality improvement portfolios are always growing. Leadership training is, HEIW is blessed with a very, very strong leadership arm, and we are getting involved in that and developing a dental portal specifically for the dental profession, so that you will see more coming in that space in the future. We are this year working on commissioning dental specialty training on a much more sustainable basis to secure and future-proof that element of the workforce and make sure that the funding is secured and it's right for the people of Wales. And we are working with other professions. We have a primary care and community workforce group in HEIW, working across all the primary care professions, GPs, optom, pharmacy and dental, as part of the strategic programme for primary care. So we're very much plugged into all aspects. But what does the dental workforce in Wales look like? So the last time a comprehensive review of the workforce was undertaken was 2012, 10 years ago. So it's some significant gaps in the data, and there were some recommendations that came out of that report about improving the data. And it also talked about skill mix. 10 years on, how far on are we? Well, we know there's a gap. We know there's work to be done. The GDC data tells us about the registrant data and where they are. This is the GDC data for Wales, and you'll see, you know, over the last 3 months, the workforce, dentists have gone down by 55, the rest of the workforce have gone up, and CDTs have stayed the same. However, when we look at comparable data across the last year, dentists have only actually gone down by 1, and the other roles have gone up and down. So the point of this is that the workforce is a fluid. It's a very fluid thing. Supply and demand of the workforce is an unstable equilibrium, and it's something that we constantly need to monitor. It's not a fixed thing, and I don't think we can think, you know, we can't plan on the basis of this is what we need, this is what workforce looks like. It's fixed and it's dynamic, and that's the point of this. These are the only, you know, the statistics are challenging, the data for the workforce is challenging, and that's something we have to address as well. We don't know where the workforce is. We don't know what the scope that they're undertaking. We don't know the demographics. So there's some real challenges in the gap of the workforce. You'll be aware of QAS, which is an annual snapshot that you've just recently submitted, and we will be pulling what we can out of that workforce data. There are plans for a national workforce workforce, the Welsh National Workforce Reporting System that GP practices have used for a few years. That will be rolled out to the other contractor professions later this year, and we're working with them to develop the fields for dentistry. So GDS is a particular challenge, getting the data, but we are working on it, and we recognise that it's something that we need to do to form the baseline. We know anecdotally there's been a shortage of dental nurses, and there's been some work done on that, and Cardiff and Vale particularly have done some work with their practices identifying vacancies. It's not unique to Wales, but there are definitely pockets where it's exacerbated through a lack of training providers. GDC registrant data tells a story of steadily declining numbers since July 19. You'll note the annual drop in the ARF renewal points every year. That's normal and to be expected. But we've got to address this, and we've got to get better at supplying the workforce. We know that the recruitment routes into Wales so this is the data from GDC, new registrants, newly qualified dental nurses registering with the GDC and what route they come in by. And you'll see that the apprenticeship route, which is the City and Guilds route, is the largest supplier, and the NEBDN route is there. But the total figures at the bottom of that table tell us that since 2018, it's been declining and declining and declining. Couple that with the workforce issues where they're leaving the workforce, and we do have a problem, and we recognise that, and we are working to address it. However, recruitment is only part of that puzzle. We've all got to acknowledge the retention issues, and these are factors that contribute to it. So we've got to do that. It's a shared journey for us all to work towards, and we're working in that space as well. Not just these dental nurses, we've got our Welsh Clinical Leadership Fellow whose project is specifically about recruitment and retention of dentists in Wales, and she'll be producing a report that will give us important data and insight into this that will help us to plan ahead. And then we need to talk about the DCP training pathways and the opportunities for DCPs a little bit. There's an all Wales faculty for DCPs that the previous Chief Dental Officer established, hosted by Bangor University, developed dental nurse training programmes that are starting to roll out. So we're looking at a long-term, the ambition is to have a Once for Wales approach. There's a practice managers toolkit that's been developed for GP practice managers, and we are adjusting it and amending it to make it fit for dental practice managers. That's an online resource that will be open access. Dental technicians, we're working to develop the opportunities there. We've established a DCP advisory forum. Career pathways for dental nurses, we need to improve our offer on enhanced skills. It's dated, and we know that, and we need to address that. Return to practice for dental nurses. So there are additional challenges that we have to acknowledge. Dentistry has 7 different roles under the same regulator. However, they each have very distinct training routes and career pathways. The term DCP is not particularly helpful because it's not one homogenous group. So I think we have to be cognizant of that and recognise it. If we look back at 2017, and Ewart referenced it in his presentation, A Healthier Wales set out very clear aspirations on skill mix, and I think every presenter so far has talked about skill mix. So we have to reference it. It's a very clear aspiration still. 2017, the pandemic has undoubtedly impacted how far we can do that, and we know we've got to do some work there. There needs to be incentives in the contract, and we've got to work with Welsh Government to address this. And you can see in there, and I saw at First Minister's questions in the Senedd yesterday, there was discussion about dentistry, and the First Minister was asked questions specifically about dentistry. And his view was the dental profession has been the slowest of the primary care professions to move in the direction of skill mix. So we have work to do in that space, and we will work with all the key stakeholders to address it. But there are challenges, and we have done, I've referenced some of them. The health and well-being of the workforce post-COVID, we have to be aware of that, and we have to put mechanisms in place to support the workforce. Data, I've mentioned, it is a real challenge, it's a real issue. The current position, the baseline, and future modelling, and we're encountering this at the moment with the specialty specialty training roles. So we've got some work to do in that space, and it's a particular challenge for GDS, as I mentioned earlier. We've got to develop the workforce to support the delivery of oral health care and primary, and you referenced it. MP WIP we rolled out, and that's been really successful. We've got our post-cert offers that we need to improve, that we know we need to align. Attraction and retention. HEIW has some very good campaigns, Made in Wales, Grow Your Own, and Train, Work, Live, and we will be engaging with all of those as we develop the offer for the workforce in Wales. Upskilling the workforce, we've done some work developing a DES framework that can work, but we've got to work with our partners in the health boards to make sure that the push and the pull is right. And working with other healthcare professions to develop effective strategies. So we're looking across, as I've mentioned earlier, pharmacy and the other professions, and looking at what they're doing and how we can align and where we can align and where there are opportunities. Cluster working will undoubtedly improve that offer as it rolls out and as it evolves. That's a whistle-stop tour. There is so much more I could tell you, but I am relatively time limited, and I think I may have gone over my time. Workforce is everything. I just want to, assure you all that we are working to address it. We know the problems. We are very aware of them, and we are working to address it. And it's not going to be a quick win. It's a long-term thing that we have to sort out and we have to do. Diolch yn fawr, nos da pawb.